Hello guys, welcome back to my channel the Physio, and in this video we are going to learn about one of the most important maneuver we use in the respiratory system, that is postural drainage. Here we are going to learn about the goals and contraindications of postural drainage, the contraindications, the conditions in which we need to avoid giving postural drainage, the manual techniques which are used along with the postural drainage. These are the percussion, vibration and shaking. Also, we are going to learn about various guidelines that are applicable to the postural drainage, and lastly, the practical aspect of postural drainage, that is positioning for draining of various lobes of the lung. So what is postural drainage? It is an airway clearance technique which is done to remove secretions towards the central pathways using the assistance of the gravity. Once the secretions move to the central or the larger pathways, they are removed using cuffing or by endotracheal suctioning. So, for example, if there are secretions accumulated in the apical region, the gravity assisted position is sitting or slightly inclined position, which helps the secretions to move towards the central region, and then it is removed using cuffing or suctioning. The goals and indications of postural drainage. We use it for two reasons. One is prevention and the other is treatment. So we prevent the accumulation of secretions in at-risk patients. These patients are patients with pulmonary diseases producing increased amount of mucus, like the bronchitis and cystic fibrosis, and patients with prolonged bedridden, patient on ventilator. If they are stable, we will give them postural drainage to prevent accumulation of secretions. Post-operative patients with restricted deep breathing and coughing, so that results in accumulation of the mucus and can lead to pulmonary complications. Therefore, to avoid them, we need to do postural drainage. Next is the treatment. So the mucus is already accumulated, so to treat that, these kind of patients are the patients with acute or chronic lung diseases like pneumonia, atelectasis, the acute infection and COPD, that is chronic obstructive pulmonary diseases. It is also given in generally weak patients or elderly patients where the chances of accumulation is increased, and in patients with artificial airways, that is the endotracheal tube, or patients who have undergone tracheostomy. In such conditions, the mucus secretion is increased, and postural drainage helps us to drain this mucus to the larger airways. Contraindications of postural drainage. The most important contraindication is head injuries. The head injuries, if we give postural drainage, that will increase the intracranial pressure and thus cause damage to the brain. Therefore, you should avoid giving postural drainage in people with head injury. Next is in patients with severe hypertension. What happens in severe hypertension if we give postural drainage in declined position? That will increase the venous return, okay, and thus increase the load on the heart. Therefore, you should avoid it. Next is following esophagectomy, which will cause regurgitation on tipping. So in declined position, the secretions or the gastric juices will regurgitate and cause damage to the trachea. Next is severe hemoptysis. We should avoid almost all physiotherapeutic maneuvers during severe hemoptysis. Aortic aneurysms, on tipping there will be pressure on the aneurysm and will provocate it further. Next is pulmonary edema. Some positions might aggravate dyspnea in pulmonary edema patients. Next is the surgical emphysema. The surgical emphysema might track down to the face in some positions, that is in declined positions the surgical emphysema might track down. Next is tension pneumothorax without IC drain. If there is tension pneumothorax in the patient and there is no IC drain in it, we should avoid it because it can lead to cardiac arrest. Okay. Next is cardiac arrhythmia. In cardiac arrhythmia, we should avoid it because there is increased load on the heart and there is increased myocardial oxygen demand, which might lead to cardiac arrest. Next is facial edema from burns. On tipping, that is in decline position, there is increased blood flow to the head, which might result in facial edema in cases of burns. Next is eye operations. Usually after an eye operation, there is some sort of swelling in the patient, which might increase on postural drainage positions. And the last one is hiatus hernias, that is on tipping. There might be gastric juice regurgitation. Therefore, we should avoid giving postural drainage position in hiatus hernias condition. Next, we are going to talk about the various guidelines which you need to follow during postural drainage. These are the time of the day, so you should do it in the morning or afternoon or evening or before a meal, after a meal. What are the guidelines for that? The frequency, like how many times a day and how many times every week you need to do the postural drainage. Next is the patient preparation. What are the things you need to do before giving postural drainage? And the treatment sequence. So what is the sequence in which the treatment is to be followed? Next is concluding the treatment. What are the final steps before you end the treatment? Modifying postural drainage. If a patient is unable to get into some position, how can you modify the postural drainage to drain that particular lobe? The next is home program. Most of the time the patient will be at home. He might visit your clinic for an hour or so, but training the person to do the position in the home is very crucial because he is at your place for an hour. Okay, 23 hours he is at home. He might come once or twice a week. He need to follow a certain program at the home. And the final one is discontinuation. So you won't continue postural drainage for lifelong. Okay, there is certain criteria or there are certain goals which we need to achieve, and then after that we can end the postural drainage treatment. So what are those conditions is what we will learn. The first guideline is related to the time of the day when you will give postural drainage. The first one is but obvious. You would never ever give postural drainage after a meal for but obvious reason. I don't think I need to explain that. Then there are two schools of thought for if you should give postural drainage before or after your aerosol therapy. So what are the reasons behind that? If you give postural drainage after the aerosol therapy, so aerosol therapy helps in loosening and humidification of the secretions. So this helps in easy mobilization of the secretions during postural drainage. And then why you should give postural drainage before aerosol therapy? So postural drainage helps in the clearing of secretions. So aerosol therapy acts better after the secretions are removed. So these are the two schools of thought and you can use whichever you want. The next one is if you should give it in the morning or in the early evening. So again, depending on the symptoms your patient gives. If he has cough in the early morning after waking up, so the secretions have accumulated overnight and he is feeling more production during cough in the morning, you should give postural drainage then. And if he feels that in the night time he is getting accumulation, so you can give it in the evening so the secretions are removed for once and then he get a good night's sleep. So according to the symptoms your patient shows up, you can give the postural drainage in that period. Next is the frequency of postural drainage. So how many times you should give it in a day or a week? So that depends on the severity and type of the patient's pathology. If the secretions are thick and copious, you will give the postural drainage 2 to 4 times per day. If the patient is on maintenance program, then you will give him once a day or once in 2 days. So that depends completely on how much secretion your patient is presenting on. Next is the patient preparation. So the first and most important thing is that you should loosen the clothing of the patient, not necessarily strip the patient, but yes, make sure that he is comfortable while the deep breathing and coughing. Next is make available the sputum cups or tissues for the patient to remove the secretions in. Next is there should be enough pillows to position the patient in a certain angle or degree, and for the comfort of the patient, explain the procedure to the patient, what we are doing, why we are doing. He should know that. Next is we should teach him deep breathing and the coughing technique. What is the appropriate coughing technique? And next, if the patient is having copious cough, so the secretions are very much, so before the treatment we should ask the patient to cough and release the secretions however it is possible, or we can suction them. And the last one is you should adjust the various tubes and wires for easy positioning of the patient, so that during positioning they do not come in middle of your treatment. So what are the steps you should follow while doing postural drainage? This is the treatment sequence. That is, first you will auscultate the patient's chest and you will determine which all lobes have secretions in them by auscultations. You will also check the vital signs. Okay. Next step is to position the patient. You will position them and check if they are having secretions while coughing or not. Okay. You will ask them to do deep breathing, but they should avoid hyperventilation or shallow breathing. Okay. Then you will percuss over the segment. So percussion is to be performed so as to mobilize the secretions. And if percussion doesn't help, then you can ask the patient to do deep breathing, and while expiration you can apply vibrations to the patient to help them secrete the expectorations. Next, if the cough is non-productive for 5 to 10 minutes in a position, then you will shift to the next position. Okay, and the treatment should not last longer than 45 to 60 minutes as it can be tiring to the patient. Therefore, wrap it up in 45 to 60 minutes according to the patient's capacity. So how will you conclude the treatment? So the first step is ask the patient to get up slowly and make them rest for a while. Next, you will watch signs for hypotension while they are getting up. Check if they are facing any hypotension signs and symptoms. What are those? Let me know in the comment section. Okay. Next is, if the cough was unproductive during the treatment, advise them that they may get productive cough after some time of the treatment. Okay. Next is, you should reassess the patient to see if the positions help the patient or not, if the lungs are clearer than before the treatment. And the last one is, you should note the type, color, consistency and the amount of secretions during the treatment. All this should be performed after the treatment is performed. So what is modified postural drainage? So you cannot always attain the optimum position. Like the textbook may say you should go to 30 degree or 60 degree or head low position or whatever. But not every patient is comfortable in that position, or there might be certain conditions in which you cannot attain those positions. Like in congestive heart failure, the person feels orthopnea, that is shortness of breath in flight line. So you cannot put that patient in that position. And then if a patient has undergone into neurosurgery, so you cannot do head down position or head low position as it can increase the intracranial pressure. Okay, so in such conditions you need to modify. Why modify? And considering, there can be contraindications, so why should you modify? Because doing something is better than doing nothing, because our main goal is to help the patient, if not always 100%, but sometimes at 30%, at 50%, 70%. However, how much we can do in that certain condition is that all that we have. Okay, so never think I need to attain this position, I need the secretion to clear completely, I am not able to hear the lung sounds completely after the therapy. It's not always like that. Okay, just see the progress, see the change. If the patient recovers only 20 to 30% after the session, that is also a win. So the home program, as I said, that the patient will be with you for 1 hour or will be with you for once or twice a week and not always. So home program plays an important role because the rest of the 23 hours or the 5-6 days of the weeks, the patient will be at home or at work doing his stuff. So you should advise him to use pillows, wedges or newspaper to change the angle. For inclination head low positions, you can use that if the patient does not have an inclination bed. And you can also use a bed, a chair, a stool to reach different positions. And for example, if there is a child, he can use that ironing table which inclines and declines. Okay, so that can be used for a child. And the percussion and the shaking techniques can be taught to the relatives so that they can assist the patient to help with their postural drainage home program. So the last guideline for postural drainage is discontinuation of postural drainage. So the first one is if the chest x-ray appears clear, that means all the secretions accumulated have been removed. So and no more accumulation is there, then you can discontinue with postural drainage. Next is if on auscultation there are clear breath sounds all over the lung, then you can discontinue with the postural drainage. And the third one is if the patient is in a regular home program and that helps him clear his secretions and he no further needs help, then you can stop with the treatment and he can continue with the home program given to him.